Hello and welcome to this week's episode of Goa Ahead. The topic that we are discussing today is, can Goa's economy survive this second wave of COVID? And what needs to be done to save lives as well as save economy? And I have three eminent panelists with me. First, most important, I have Area Director of TAG, Vincent Ramos with me. Vincent, welcome. Next, I have with me President of Travel and Tourism Association of Goa, Nilesh Shah. Nilesh, welcome. And last and most important, Dr. Rajendra Borkar, who is the Chief Medical Officer for Vaccination in the state of Goa. Vincent, I'll start with you. How is the industry tackling this second wave and what do you expect from the government? What needs to be done? Because one thing is clear now, the government has made it abundantly clear that there is no question of shutting down anything. We may survive COVID, but we will not survive financially. So when, from an industry perspective, how do you look at it?
Thank you, Pramod, and happy to be on this channel. But yes, that's a very good question that you posed to us and to me, in special being in the hospitality industry. What we see now is that we are or we should be very responsible citizen. It's about humanity, it's about economy, it's about our Mankule Goy. We have to be very, very responsible in our jobs. At the hospitality, I have managed to get about 90% of the people vaccinated within the people who are under my jurisdiction. But what we are really looking forward is the frontline vaccination, because we believe that the hospitality sector, which is keeping the economy of Goa alive today, and we want all the hospitality people, because it's not about me. COVID is not about me. It's about you today. Because if I get vaccinated, I am saving so many lives.
Nilesh, what are your thoughts on it? Because one thing now is clear that we are keeping the industry open. Most of the tourists across India are coming to Goa. There are very less choices to go outside India, so everybody is flocking to Goa. So even if there are different strains of viruses, I think everybody is landing in Goa. So from the TTAG point of view, what do you expect the government to do? And from very, very pragmatic aspect, when you look at so many numbers coming into Goa, are you worried?
Actually, it is a worrisome, because the way the cases are going up, the fear is always there. Even if government has said that the show will go on, as our tourism minister goes on saying. But basically, to industry to continue, the COVID appropriate behavior is a must, which is lacking big time. So we have been requesting, even last week, collector North and South had called hoteliers individually and given them the feedback that the things which needs to be done. So that has to be done strictly. Secondly, when tourist is going out, let's be very, very clear, they are come on holiday. So we'll have to go and keeping them reminding that you are right now, COVID is here and you need to take care. Unfortunately, what we have been seeing, after repeated request, there has not been hoardings put anywhere, any tourist place. It may be near the Penjim Church or Miramar or Kalangut or you name it. So, the basic starts there, the besides, awareness is lacking big time from the government. Because see, unless you continuously address the issue, that is only where, you can go on putting in the mind. So it is not only tourists, it is even the locals who are, you will see in our WhatsApp university, people commenting on, the tourists are coming in so much and, they are spreading. I agree, I am not trying to defend anyone, but as a local also, we need to follow the COVID appropriate behavior, which is lacking big time.
Dr. Borkar, how is government looking at this? Because one thing, economy and lives. Right now, I think it's a very difficult choice to make, but we all have decided that both should go hand in hand and we need to protect the both. How is government looking at it? Vaccinating hospitality sector on priority in a state like Goa, can that be an effective strategy?
Yeah, let me put our view on this. What actually is happening is we have to understand that COVID is not just a medical problem. I would put it this way, it's a medico-socio-economic problem. So we have medical problem, yes, agreed. We also have social problem. So also we have economic problem out of COVID. So government is trying to have an equilibrium with all these three. And that is why the decision has come not to think at this point of time of any closures for anything. Because we understand that if we restrict the businesses, if we have lockdowns, as one of the speakers already said, that we may be able to curb COVID, but then our finance will be affected tremendously. And then that again is going to impact our own citizens. So what we have, what we call it as Trisutri, we have three things on this issue. First is we try to trace the people, we try to test the people and treat the people. That is one way of containing the source. Second most important is everybody is harping on that is COVID appropriate behavior, and that appropriate word is very, very essential. As we are saying, we have three things that we can do about. Is first, I would put it as for simple for remembering, it is SMS, and SMS is one is the social distancing. Second is wearing the mask, and third is sanitization. And mind you, all these things are to be done by we all, Goans. The government has nothing to do in this. We have to be the responsible citizens. We have to have the civic sense, and this is not costing us anything. And the third thing, as you have rightly mentioned, it is vaccination. And I believe government from its side is doing everything that is possible. We are trying to create awareness, and as one of the speakers has said, some hoardings, some boards. Yes, I agree. Because of the code of conduct, they were in the pipeline, but very soon the hoardings are going to come. The proposals have been put, and everywhere there will be the hoardings on this side. But the civic science and the responsibility is very important, because if you see now, everybody is having a mask. There is no person in Goa without a mask. But that mask, which has to be on the face, on the nose and the mouth, is on the chin.
Yeah.
Avoid what is avoidable. We don't say avoid everything, but what is avoidable, like jatras, like big gatherings, religious congregations, avoid them. But we have to go to job, because that is not avoidable. So my formula is avoid what is avoidable, and follow these three sutras.
Yeah. Vincent, you feel that if government starts vaccinating hospitality sector on priority in a state like Goa, it will be very effective in terms of if not stopping, at least curbing the growth of the virus.
Completely, Pramod. I completely agree on this, and I think that's the best thing that can happen to Goa, because what is the economic the status of Goa? A lot comes from tourism. We have to understand that it is not that it's that we want to get vaccinated. No, we want to get vaccinated in the interest of the tourists, the people of Goa, so that we can keep the livelihoods alive. I as a area director get calls even today. People are out of jobs. There are so many people who are come down from the ships. Every day I get on average 4 to 5 calls. Sir, I have been out of job for the last 1 year. I need to go on. So what we did was we had kept people who are with us. We are taking care of the people who are working with us. But I get calls from so many people. Now I've run out of this business. I've run out of this business because we used to do it in so many ways. Or maybe it's a guy who was putting flowers, or so many things. So you feel really, really pity that we are only looking everything on the surface of it. If you go beneath, there is a lot of people that have been affected by this COVID. And as I've said, that vaccination is, and I completely agree with what doctor said. I think he well put it, and also Nilesh well put it, that yes, vaccination is the way forward. Yes, SMS is there within us, but if we do not now raise to the occasion, of vaccinating ourselves, you cannot postpone this. You cannot get away from this. For the first 2 months, we had only 4 to 5 cases. We thought that we got away with it. No, you can't. You have to go to this. And the only way I say is vaccination is the way
Get maximum
forward.
people vaccinated, and let us not show any hesitancy in doing
Absolutely.
that. Nilesh, you agree with that? Considering our economic situation right now, tourism is the only driver of the economy.
Absolutely.
You want hospitality sector to be vaccinated on priority?
Absolutely. In fact, this request, we have sent it to the minister almost 1 month back, that to consider the hospitality sector as a priority sector and allow to vaccinate. But I think we sooner or later we should have it. But my concern is different. Right now they have opened it to people up to 45. Anybody can go and vaccinate. Now, if you see the general tendency when you're talking to the people, there is so much of again some WhatsApp University which they want to follow, but they don't want to follow the what Dr. Borkar is saying.
They trust their WhatsApp more than their doctor.
Absolutely. So immediately is that let the people who are above 45, who are allowed to vaccinate, they should come in front and see that by end of April, all of them in Goa is vaccinated. Because if you see, the Sunday also the government has kept it open, and you see like this Sunday somebody told me at one of the in GMC they have a special cell. There was absolutely no one there, and vaccinating hospitality industry will go long way into building sending a right messaging. Because if you want to get the business wise, the messaging has to go that Goa is safe. People who are serving you are the safe. So that will go long way in reviving the economy of Goa. So I think that should be
very,
very
very crucial. Dr. Borkar, 2 points. Number one, how much will this strategy be effective considering our economic requirement right now? That let's vaccinate the hospitality sector on priority. And secondly, we have anyway opened it universally for all those who are above 45 years of age. Why is there so much reluctance?
I will tell you, the vaccine is a scarce commodity. We don't have abundant vaccines. So we have, though adequate, but limited supply. And when we have more demand and lesser supply, we are trying to prioritize. So what Government of India has done, that it has prioritized the healthcare workers first, then came frontline workers, and then has been the priority group of 45 and above. Earlier they were saying 60 plus and 45 plus with comorbidity. They have now relaxed, and they have now said anybody who is more than 45 should get vaccinated. This is prioritization depending upon the need. There is an agency by the government called as NAGVAC, which is National Group on COVID Vaccination, and the expert group it is, and they decide how to go about. I agree that the hospitality sector also needs to be vaccinated because it is a major our financial source. But then we have got the request from petrol pump people, bankers, post, teachers, and all these people are equally exposed. A day will definitely come when we all will get vaccinated. But as rightly said by one of the speakers, those who are given the vaccine are not coming for the vaccine. If you permit, I would like to quote one Urdu shairi just for the heck of it. That दुनिया ये जादू का खिलौना है, दुनिया ये जादू का खिलौना है, मिल जाए तो मिट्टी, खो जाए तो सोना है. Till the time it was not available, we were saying, give me vaccine, give me vaccine, give me vaccine. And now the vaccine is there, we have hesitancy. And I'll tell you the reason for hesitancy. Some people say, I had already COVID, so I don't need vaccine. Some people say, I never had COVID and I will never have COVID, so I don't want to have vaccine. Some people say even after having COVID, most of the people have recovered very safely. Government has so many beds for COVID. And then it's 1 year over the COVID now. Doctors know what to do, how to do. Everything is known. Now I don't have to expose myself something unknown, that the vaccine, so I don't want to have vaccine, and they would find out a reason why they should not be vaccinated. This is very pathetic. As has been rightly said, that will decrease our mortality, that will decrease our morbidity, that will decrease our hospitalization, and we will be a safer place to live. If from the healthcare worker, let me promise you and tell you that if which the second wave is already there, we are better prepared as healthcare workers and frontline workers, because approximately 80% of the healthcare workers are already vaccinated. And as you have rightly pointed out, with all the surge in the cases, there are hardly any healthcare workers who are getting affected by COVID.
Because they are vaccinated. Vincent, is a very important, and Government of India is also thinking of opening vaccination drive to all the workplaces from probably next week. Do you think Goa's hospitality sector is up for it, that not only a big group like Taj, but even smaller hotels, smaller resorts will be up for it, or there will be similar kind of hesitancy and reluctance when it comes to vaccination? Because if the government is saying they are going to open it for all the workplaces, at least there is the understanding that people who are coming out of their houses to earn their livelihood should be vaccinated first. How would be the response to that?
We need to drive this, and hospitality is not a shallow word. It's a big word. The taxi drivers, as you rightly said, the bread man, the egg man, the musicians who depend on this, it's a very, at least 5 livelihoods, are created by the hospitality industry, 5 industries, in different industries. It need not be service in a restaurant or need not be cooking of food, but there are a lot of people who are dependent. And I don't want to be saying selfish to myself, you're saying it because I work for hospitality. No, it's not a war about hospitality or getting our people vaccinated. No, it is about, as I've said, that, it is about that you are doing this thing for the mankind now. You're doing this vaccination for the humanity. It's not about me. It's about for the others that we are doing this.
Yeah.
And we need to make sure that everybody in the hospitality industry
Comes forward.
Yeah. I can speak for the hospitality industry, but as Nilesh also said, there are a lot of other industries, and as you rightly
Yes.
put it, that there are so many other industries that need, like the doctors or whoever, but everybody has to think for themselves, fend for themselves, and we have to, as I've said before, raise to this occasion, make it an exercise, and make it a very, very compulsory exercise in our minds, like we had measles vaccination or any vaccination,
Yes.
that this is going to save our Goa and save our country, and let's be an example. Let's be an example.
Being safe.
By being safe.
That's the whole irony of it. Somebody is asking you to be safe by taking a vaccine.
Correct.
And we are showing hesitation. So Nilesh, same question. Do you think if it is open for workplaces, then our hospitality sector, which is right now driving our economy, is up for it? And will the industry captains push for it?
Absolutely. In fact, that is a need of our. And if you actually open up, I am sure more and more people will come up for vaccinating. Of course, there will be a few people who will be hesitant. I think, but there has to be more and more awareness which will be created by the industry, and I'm sure the leaders in the industry or the hotels or the agencies which are heading those institutions will push their people to make it compulsory in sort of that they need to be vaccinated if they want to be come in the premises of those places. I think those things will be followed by the industry to see that they are safe. People who are working around are safe. People who are coming in the indus hotels, they are safe, and the people surrounding people are also safe. So that is the 3 count. And if you see initially in Goa, people were reluctant to when the industry was starting, especially locals around. Now we have to understand that again same thing, when everything is freely available now and people are hesitant, which is literally mind-boggling, that why people are hesitant. So
we always talk about what we expect from the government, but in cases like this, what do you expect from the industry? Because looking at this hesitancy, looking at the number of people coming out, from the government perspective, from the health department's perspective, what do you expect from the industry?
For industry's sake, I want to say that we have already taken the initiative, and at Kundai Industrial Estate and at Verna Industrial Estate, we have already started vaccinating the people. I mean, we have taken a proactive step. The problem is there is lot of misinformation. And because of that misinformation, people tend to avoid, people tend to hesitate. I just want to tell here is that this is a war between the virus and the vaccine. And if we have our, CAB, that is COVID appropriate behavior in place, it won't take a long time because that virus is a small particle. Unless we help the virus to spread, that virus cannot spread. We have seen that on 16th Jan, the health workers started getting vaccinated. But even today they are coming that I was left and please vaccinate me.
Yeah.
This is irony.
Yeah.
This is our typical Goikar point is Sushagat. That we have to leave. And we don't have to believe that the virus is gone. It is here. And even in our Sanskrit literature, they have told us thousands of years back, which are the 3 things which we cannot take at an ease. What they say is that Runashesho, Agnishesho, Vyadisheshasta Thaivacha, Punascha Vardate Asmat, Tasmat Kshesham na Rakshayet. What it means is that the loans that we take, any illness that we have, and the fire that we see, even if it is very small, till the end we have to follow and finish it off, or else it will surge up again.
Yeah.
So this is
Vincent, very on that thought, finally, I am tempted to ask you this, how has been the business? Because everybody is flocking to Goa, everybody wants to come to Goa, and as Nilesh said, ki there are no restrictions in coming to Goa. You don't even need a RT-PCR test to come to Goa. So how has been the business, and whether this second wave is going to impact it?
So the business has been very good for Goa until 4 days back. I can proudly say that, and that's because everybody cooperated. Today we are in a scenario, it's a scenario between good life and bad life, or I would say heaven and hell. Today we are in hell, right? The way it is going. Okay, and they say that you have to do some good deeds, or many good deeds to go to heaven. I would say that you just have to do one good deed to go to heaven now. In the sense, we are in a health situation, you have people dying, you have this commotion, we are wearing a mask. Why don't we imagine a world without a mask? You can go for a holiday, you are free, your children can go abroad, for a holiday or to study, or we can go. So let's come back to that heaven that we had. But let us not have this one bad deed. That one deed of vaccination is going to take us to heaven, to that world that we were in. But yes, it's a very temporary phase, but the way it's going now, it's really, really frightening. But if we change our minds, remove this chalta hai attitude from our minds, and it's not too late. We can correct ourselves.
Yeah.
And
the only difference, I always say that the only difference between last year and this year is we have a vaccine.
Absolutely.
Yeah.
Absolutely.
Yeah.
And we have a chance to go back from this bad world to this good world.
Yeah.
Okay, the choice is ours.
The choice is ours. Right now, it is not like last year when the virus was there, we didn't know what to do.
Correct.
We know what to do.
Correct.
The problem is we are not doing it.
Correct.
Nilesh, finally, we spoke about what industry expects from the government, what government expects from the industry. Very quickly, on the business front, are you worried looking at the numbers right now? And what do you foresee?
Absolutely. In fact, it is worrisome. And if you see the trend, the business, there's a lot of cancellations coming in. Maybe in the flights also, a lot of cancellations are coming in. Hotels also, a lot of cancellations coming in. And the worst is not yet over for Goa. Because a lot of small hotels has been, every time I repeat whenever I come on your channel locally, that a lot of small hotels are not still started. The worry is to get all segment of tourists into Goa, we require people to behave with COVID appropriate norms, because COVID is here to stay for some times.
And
let's be very, very
whoever
clear.
comes to Goa, let them not throw caution to the wind because they are in Goa.
Absolutely, absolutely. Not only that, the things of it will not be far, wherein the COVID passport will be the way forward. So looking into that, I think the people should vaccinate whenever the opportunity comes to take the vaccination, and I think that will go a long way in getting Goa, India and the world back to the normal.
This is help yourself, help
right
the
now,
world kind of
absolutely,
a scenario.
As Vincent just said, I think we have to do little bit our part of it, of getting vaccinated and following the protocols, COVID appropriate protocols.
Doctor, finally one message that you give out to everybody. We have said come out, get vaccinated. One message finally that you want to give out to everybody.
I would only tell that Goa already has 60,000 and odd number of cases. We already had 840 deaths. And as of just yesterday, our number has come up to 527 new cases. So we are sitting on a volcano.
This is almost a 100% jump from the previous day.
Yes.
Yeah.
And that is why we should be on our toes. We cannot take the things for granted. We cannot be sushagat. We have to follow COVID appropriate behavior. We have to get vaccinated, and all these things government has made free of cost. So it is only
another thing.
This is only our initiative.
This is just the willingness to do it.
We have to just step out of the house, do something. And I say that one fellow who gets vaccinated at least should get 10 more to get vaccinated. If that is done, nobody more are needed to.
That's a very nice thought, doctor. The way virus spreads, if one person gets the virus, he can infect 10 more people. You are saying let's reverse the chain. If one person gets vaccinated, let him
bring
inspire,
at least
inspire 10 more people
and
to
then
get
I have
vaccinated.
another slogan which should go from your
Yeah.
media. If we do something, we say Yashasvi Bhava. I tell everybody Lasasvi Bhava. Lasasvi Bhava
I
and
think,
Lasasvi Bhava.
I think there is no better way to end that program. Sir, Dr. Nilesh, Vincent, thanks a lot for joining us. And only one message, get vaccinated. All the experts are telling you, the industry is telling you, the only way forward is getting vaccinated. And the irony of it is, it's free of cost. And we are not doing it. So Dr. Nilesh, Vincent, thanks a lot for joining us. Keep watching. Go
Thank
ahead.
you. Thank you so much.
Thank you.